Hi everyone, I'm Dr. Leo and this is Dr. Fernandez.
Hello.
We're here to talk about arthritis and how we can manage the symptoms of it. As physical therapists, we don't cure arthritis, but what we do a lot is we help manage the symptoms so that you can get through your day-to-day activity. Arthritis, I'm sure you know, is bone-to-bone contact. So we're going to pick one of the most common arthritis, which is at the knee. So I have a knee model here. And if you have arthritis, you're not gonna have any cushioning in between the two bones. So that will cause your bones to rub against each other. And if it's happening, you're gonna get inflammation and you're gonna have a lot of pain.
So what we can do is we can make sure that we wear our shoes or sneakers with proper cushioning in the heel. Like a nice inexpensive running shoe or walking shoe will give us more support. And the way the shoe is built, it actually helps to absorb impact when we walk. We try to see if we can stay away from the hard-soled shoes and flip-flops, since they won't give us that much cushioning.
Yeah, and if you have a lot of arthritis, moderate to severe arthritis, we recommend wearing shoes even in the house. I know most of us don't like to wear shoes in the house, but if you wear shoes, with the cushioning, that will just absorb the shock and help you manage the symptoms better. When we talk about stance, sometimes it's just in our habit, we tend to just lean on one side.
So basically, as he's leaning to one side, these joints on this side of his body are taking up most of his body weight and pressure.
Right.
If we have a heavy handbag, we want to try to see if we can put it upon the shoulder opposite of that knee pain. That way, otherwise what happens is if we have a heavy bag, we tend to lean more onto that side of that heavy bag, therefore putting a pressure onto the leg joints that may be dealing with the arthritis. So we want to see if we can switch to the opposite shoulder or the opposite side where we're feeling that pain.
Yeah, just imagine the weight going straight down. So if you have a heavy bag here, the weight is going to be distributed mostly on that knee. And if you already have a lot of arthritis there, you're just going to have more pain. The thing I want to talk about is the use of an assistive device. So we'll use a cane as an example.
Okay, so if I'm having pain in my right knee, which I could use as a cane here, and I'm going to hold it in my left hand. Okay, so as I'm walking, the cane allows me to distribute more of my body weight on this side and less on the hurtful side.
If someone with more severe arthritis, they tend to go on a rolling walker or walker, and that distributes your weight a lot better. Okay, and there's no shame in using a cane or a rolling walker. So we highly recommend that patient utilizes it. So the next thing that we want to talk about is the daily management. And
we want to try to see if we could take a look at some of the things that we do on a daily basis and maybe modify them a little bit. For instance, a lot of people like to garden, and it's a beautiful time of year and we're all outside. But what we have a tendency to do is we'll go, and when we go into the garden, we're either bending, okay, and squatting down to lift things or pull weeds, or we could actually be on the knees themselves, which causes a lot of pressure onto the joints. So what we can do is to modify that a little bit, maybe use a small chair or a stool to sit on. So that way we're putting less pressure on our knees and our joints.
yeah, if you don't have a little stool, you could just find a basketball or any kind of little ball and just put it behind you so you can sit on it, and that will really decrease the stress on your knee, right? We as therapists focus on exercise, right? And exercise has certain benefits to the patient.
Well, we can focus on, as far as with exercises, what we could do is strengthening.
Yeah.
So what we want to do is, as physical therapists, we can show patients certain exercises to help strengthen up the muscles around the joint, because muscles act like shock absorbers to your car. Muscles act as shock absorbers to absorb impact. So we want to strengthen those muscles to support the area around that joint and support that joint.
Yeah. And for my patients, what I prescribe most of the time is the non-weight bearing exercises. Like they would do exercise on the table so that they're not putting a lot of pressure on the joint, and do a lot of bicycle, which is just move the joint and keep the muscle going, and recommend swimming. Okay. Last but not least, there are a lot of things that we do for pain relief. We have a lot of manual techniques and a lot of equipments that we have that that focuses on reducing the pain. Okay. Yeah, that's it, right? If you have any questions, contact us at Reddy-Care. And anything you want to add?
covered quite a bit there.
I think so too. Good job,
Okay,
Michelle.
good job.
All right. Thanks for watching.
Bye-bye now.